Ma. But
She's
you
2
didn't
years
tell us
old.
your name, Ma.
Yes.
Sorry, Ma.
Sorry, I'm sorry. My name is Grace.
Okay,
My
Ma.
name is Grace.
You're calling from?
Ikorodu Greek.
All
Okay.
right, Ma. Yes,
So
Ma.
when
Go
this
ahead.
child was about 3-4 months old, she started having catarrh every time. So we are thinking it is teething problem. So we've gone to hospitals, and they say maybe it's this or maybe it's that. At the end of the day, when she was about 1 year old plus, she was diagnosed adenoid.
Yes.
I've never heard of it before. So when she was diagnosed, she was having is no more catarrh or whatever, adenoid. So they now referred us to ENT. That was ENT. At the end of the day, they booked the child for surgery, but the surgery have not been done. The child is 2 years old now, but she started picking words. It can say daddy, can say money, can say bye-bye. So I don't know, is there any medicine that they can do? Because I've never heard of that word before.
Now, Grandma.
Thank you, Grandma
from
Grace.
This was what I was trying to tell Mr. Folabi from
Ayobo.
Ayobo. When a child or any person that has an oropharyngeal problem, the ear opening, the nasal opening, and the oral opening, the mouth opening, they all meet in the pharynx. So that is why we have special doctors called ENT, ear, nose, and throat. Now, a child may not be able to talk because of adenoid. This is a classical one. Grandma has just told us. So the main person to attend to that child and rule out all these adenoids or things in the pharynx are the ENT surgeons. They rule it out. If a child has an adenoid, there is the medical treatment and the surgical treatment. When the child comes first, they start the medical treatment. But when they look in and it's occluding the airway and it's causing a lot of issues like what Grandma has just said, the surgeon may say at this stage the medical treatment may not suffice. So we go straight to surgical treatment. And it's a procedure. They will put the child to sleep, and they will, from the mouth, they will do everything, the ear, nose, and throat. They start through the nose, through the mouth, they get everything they need to get out. So she should be patient, and one of the earliest signs is constant catarrh. An unstable oropharyngeal airway, being irritated, and you're just bringing out all sort of mucor and the rest of them. So if it's adenoid and the ENT surgeon has seen, I think they should get it done. Now, where you get care depend on what you can afford. If you get to a government settings, there's always a queue. So you join the queue. That is why she said they booked for surgery. The child is 2 years.
But some progress is being
on the waiting list. So the child will continue keeping the clinic appointments, so that if there's a need for medications, they continue to give medication. Now, if is there a phone call?
No, I think she's still on the line.
Okay.
So she's
now.
Okay.
If the patient can afford a private, because these are not things you actually want to delay for years. Different people have different pockets. But what is most important is that the child should see an ENT surgeon and get the proper care. The merely it is done, it is done. All those symptoms will resolve. Now, when you see a lot of adults snoring, invariably more than 60% of them had adenoids in childhood, and which wasn't treated. So they are really snoring because the airway is almost shutting down. So the person has to use a lot of force to get air up and down. That is why the snore comes.
Interesting. Thank you so much, Doctor. I hope Grandma got that. And as much as possible, you need to be patient with your medical your healthcare providers. I want to believe that they do know what they're doing. So just go through, the treatment procedure that they have for you. Thank you so much for calling. Before we got that call, I was talking about, the spinal cord injuries that happen to our children.